Good morning, everyone. I can report 22 new cases overnight, 14 of them linked to current exposure sites or identified close contacts, 8 still under investigation. Disappointingly, only 2 of the 22 were in quarantine during their entire infectious period. At least 13 spent part of their infectious period in the community, and the balance are still under investigation. We have 10 people in ACT hospitals, 2 in intensive care, so a reduction from yesterday's number, with 1 of our intensive care patients still requiring ventilation. Yesterday was a strong day for testing across the Territory, with 3,721 tests conducted, giving us a very good level of surveillance of where the virus is in our community. But as always, if you have any symptoms, please come forward for testing. If you've been in any of the exposure sites during the identified times, please come forward for testing. Today we indicated we would provide the path forward for the ACT. Based on the public health risk that remains for the Territory and what we are seeing in our region, including the recent change to the situation in the Yass Valley Council, the Chief Health Officer has recommended to the government that the ACT lockdown should be extended for a 4-week period until Friday the 15th of October. There will be some minor amendments to the public health directions that will come into effect this weekend. These changes will allow for increased COVID-safe small business activity in areas such as contactless click and collect and online delivery, limited private appointment real estate inspections, and additional outdoor activity including social, golf and tennis. A midpoint review of the public health directions will be conducted in 2 weeks' time. So with this announcement, our priority over the next 4 weeks is to vaccinate as many people as possible. During this period, nearly 50,000 Canberrans will receive their first vaccination dose at an ACT government mass vaccination clinic. 35,000 people will receive their second dose and become fully vaccinated. Tens of thousands more will receive their first or second doses through GPs and pharmacists. Higher levels of vaccination will support a safer pathway forward for the Territory, especially with the virus still spreading in our community and increasingly across the Canberra region. As the nation reaches the vaccination thresholds outlined in the National Plan to transition Australia's COVID-19 response, we will be in a position to support the gradual easing of restrictions in the ACT. Based on the current vaccination trajectories, the nation is anticipated to reach 70% and 80% effective vaccination milestones in mid-October and early to mid-November. This will be driven by the strong vaccination program in New South Wales, Victoria and the ACT, which combined comprise 60% of the national population. Now, this next month is a period of uncertainty, and the next few weeks will be challenging. What we are certain of, though, is that a highly vaccinated Canberra is a safer Canberra. This is the safest path forward, and it will lead to a safer Christmas, a safer summer day holiday period, and a safer 2022. The positive news for the ACT is that we have such a strong vaccination take-up. Yesterday we reached 50% of our population aged 12 and above fully vaccinated. Now, as a result of today's announcement, the government will extend and expand a range of business and community financial support measures. The previously announced land tax and commercial rates relief will now be doubled and extended until 31 December 2021. We will increase the utilities concession to $1,000 in this current fiscal year 21-22. This will help the most vulnerable 31,000 Canberra households with one of their most significant expenses during the year. Over the coming days, the government will make additional announcements regarding further crisis response funding in areas such as mental health and community services. The 21-22 ACT budget will be delivered on 6 October, and in the budget we will make further investments in our community to support those who need it most. The ACT government is currently finalising agreements with the Commonwealth Treasurer to extend the jointly funded financial support programs for local businesses and the COVID disaster payments. We anticipate being able to make joint announcements with the Commonwealth Treasurer shortly. Turning now to schools. Based on the advice from the Chief Health Officer, the government has developed a plan for the first 4 weeks of Term 4 in our local schools. Year 12 students who have had priority access to vaccinations over the last 2 weeks will return to on-campus learning from the start of Term 4, that is Tuesday the 5th of October. Year 11 students will return to on-campus learning from week 3, Monday the 18th of October, subject to the health situation not deteriorating between now and then. ACT students from preschool to year 10 will continue remote learning for at least the first 4 weeks of Term 4. Our goal is to get kids back to face-to-face learning as soon as it is COVID safe to do so, and we will continue planning for the phased return to on-campus learning for preschool to year 10 kids in Term 4. Shortly, I'll invite the Chief Health Officer to outline the local epidemiological situation that has informed the decisions the government has made in relation to the lockdown extension. The Minister for Health, Rachel Stephen-Smith, and Deputy Chief Minister, Minister for Education, Yvette Berry, are also here to answer questions. So for those who have joined late, a quick recap: 22 new cases overnight, 14 of them linked, only 2 in quarantine during their entire infectious period, at least 13 infectious in the community, 10 people in hospital and 2 people in intensive care. And again, we thank the wonderful staff of our intensive care units at Canberra and Calvary hospitals for the support and care that they are providing those people. I'll now invite Dr Coleman to provide a further update, and then myself, Ministers Berry, Stephen-Smith and the Chief Health Officer will be available for questions. Thank you.
Good morning, everybody, and thank you very much, Chief Minister. So just to repeat, the total cases for this outbreak is now 528, with 22 new COVID-19 cases notified since our last update. We do continue to see people recovering, which is good news. Our total number of recovered cases is now 276. So we currently have 252 active cases, which our teams continue to manage and support. So of the new cases today, I can also confirm that of the 22, 14 can be linked to known cases or ongoing clusters, while 8 remain under early investigation. And of those 14, we know that 9 of these are household contacts. Of the total 22, unfortunately, as the Chief has identified, only 2 were in quarantine during their whole infectious period, therefore posing no risk to the community. Of the remaining 20, there are still 7 that we need to collect further information from to make this assessment, but 13 did spend at least some time in the community for part of their infectious period. We have 10 people in our hospitals. 2 of these are in ICU, with 1 requiring ventilation, and of those 10, 2 are fully vaccinated but not in ICU, 1 is partially vaccinated with 1 dose, 6 unvaccinated and 1 unknown at this point in time. Our youngest patient in hospital is in their 20s and the oldest in their 70s, with the age range of people currently in ICU between 40 and 60 years of age. Included in today's new numbers is another case linked to Ainslie Village. This case was identified as part of our in-reach testing program that we're using for some of our higher risk settings. As we've discussed before, we are continuing to work closely with our partner agencies and non-government community partners to communicate and work directly with the residents and provide ongoing clinical care as well as support. Today, we have almost 1,000 self-identified close contacts with over 320 active exposure locations. And I'm sure you're getting sick of me asking you, but please continue to keep up to date with these exposure locations. Check on our website. If you've been to one during the time frame, please follow the relevant public health advice. So as we move to extend the current lockdown, I would like to give you an overview, as we've been talking about for the last couple of days, of the current ACT outbreak and the factors that have contributed to this decision. Extending these restrictions that effectively limits your ability to move freely around the ACT is clearly not the decision that we wanted to make, but it is the one that we needed to make to control the spread of COVID-19 in our community at this point in time, this week. Since the first case was notified on the 12th of August 2021, there have been a total of 528 cases associated with this outbreak in the ACT. When we look at our demographics, just over half of these cases are male, and the median age is 26 years. The total age range of our cases is from under 5 years of age to over 80 years of age, so a very wide range of ages have been impacted. 62 or 12% of our total cases have received 1 vaccine dose or are partially vaccinated. 26 or 5% are fully vaccinated, but the large majority are unvaccinated. That is around 434 of our cases, or 82%. And this is completely consistent with the other 2 jurisdictions in Australia who are experiencing outbreaks at this point in time. We are now in the 5th week of this outbreak. There have been approximately 120 cases notified per week since the outbreak began, with 32 cases being the highest number reported on a single day. Following a rapid increase in the number of cases at the very start of the outbreak, which is what we normally do see, our numbers do appear reasonably steady, although they are fluctuating on a day-to-day basis. And because we are a small jurisdiction, this fluctuation can sometimes appear quite large. It is important to note, though, that approximately 50 cases, we do not know the contact or source of their infection. And concerningly, over half, around 28 of these cases, have been notified within the last 2 weeks. So that number is not decreasing, which is what we would like to see. These unknown cases suggest potential unidentified chains of transmission in the community, and therefore posing an increased risk, especially for those in our community who are yet to be vaccinated. Public health social measures, such as restricting movement within the community, is actually the only way that we can reduce the risk of these unidentified transmission chains causing further infections in the absence of high levels of vaccination coverage. And I know that many of you have been interested in our effective reproductive rate, which we are just managed to hold around 1. So the estimate from the modelling we have access to is 0.96, but with the uncertainty around that, it is around 1. This is therefore very reliant on us maintaining our effective control measures. Currently, almost 2/3 of our total cases have been infectious in the community for some or all of their infectious period. And as you've heard today, that's another 13 of our cases today present some degree of risk of transmission. And as we've talked about before, whilst a number of these are expected due to movement in the community associated with essential work and essential activities while we are in lockdown, this still does present a risk for further spread at this point in time. We've also had 21 separate clusters with an average of 17 cases per cluster, and these clusters range in size from 2 to 52 cases per cluster. The settings where these clusters have occurred include, but aren't limited to, households and private areas and settings. We've seen workplaces as well as pubs and nightclubs, and these are the ones that I talk about when I talk about our exposure sites where there's been public transmission. At this time also, there appears to be 8 separate introductions of the COVID-19 Delta variant into the ACT since the start of our outbreak. Now, some of these are the result of individuals with exemptions coming in, doing the right thing and abiding by our necessary quarantine requirements, which is great. So they've been identified, no risk to community, no ongoing transmission, and I think it's a really good indicator that our exemption and quarantine system is doing the job. But half or 3 of these have led to transmission within our community, with 2 of these only occurring in the last 48 hours. And I think what this does is it just highlights the current status around Australia, that it highlights there is an ongoing threat or an ongoing risk of introduction of COVID into the ACT community. We note that we are seeing cases in our immediate neighbouring regions, probably more so in the last week or so than we have for the rest of the outbreak in New South Wales. So not only do we need to be aware of the cases in the ACT, but those in our surrounding regions, as I'm sure that they're aware and monitoring ours. We will, of course, continue to work closely with our New South Wales southern neighbours on a joined-up public health response to cases. The Canberra community has done an outstanding job of following our health advice and our directions, and this is actually what has enabled us to keep our case numbers at the level that we have at the moment. But I do know that this is hard and that people have had to make many sacrifices, and that the lack of connection with family and friends has made this lockdown incredibly difficult, particularly for some members of our community. This is actually why it's really important that when we do move towards easing of our restrictions more, that these plans are really carefully considered and evidence-based. We want to make sure that we don't undo all the good work that the community has done to get us in this position. So we are extending the lockdown. At this time, the combination of unknown sources of transmission in the community and the number of people yet to be vaccinated means that this risk is too high. When all of our businesses open, we want them to stay open. When our kids go back to school, I'd really like to be able to keep them at school. And when stay-at-home restrictions end, we'd really like them to stay that way this time round. So I really ask all Canberrans to keep working together to stay the course and help us protect our community. And please know, this was not an easy decision for myself and my team. We have considered all of this evidence and have really taken the time to consider this important direction that we're now moving on. I know that this isn't the news that a lot of you wanted to hear today. I tried not to do my shout out today, but I'm still going to do it because I think it's important to acknowledge everyone in the community who is getting vaccinated, who is staying at home when they can and really following the health directions to help our community come out of the lockdown as soon as it is COVID safe to do so. Thank you, everyone, and I'll just hand back to Chief to start with questions.
Thank you, Dr. Coleman. Happy to take questions. We'll start on this side of the room. Harry?
Chief Minister, what's the ultimate goal now of this extended lockdown? Is COVID zero still possible given the situation in New South Wales?
Well, look, New South Wales have been problematic for the nation throughout this process, and they're incredibly problematic for the ACT, given we are a jurisdiction sitting wholly within that state, and we are seeing incursion of the virus outside of the Greater Sydney area. So I've said this from this podium, probably a dozen times over the last 30 appearances that we have been at risk from New South Wales, we are at risk from New South Wales, and we will continue to be at risk from New South Wales in the weeks and months ahead. We have an objective to try and get the number of people infectious in the community as close to zero as possible. Today has not been a good day on that performance objective. We have had other days that have been considerably better. So it remains a challenge, but we do look beyond the headline figure of how many new cases to the cases infectious in the community and their level of risk. So another factor here is, given the public health settings that are in place, how many people have infectious cases come into contact with. Were the infectious cases wearing a mask? How long was any contact between an infectious person and others? Now, the experience has been that once you are infected, you are highly likely to infect everyone else in your household who isn't vaccinated, and sometimes even infect people in your household who are vaccinated. What we're seeking to limit is the more random transmission between strangers. That is a challenge, but if there's any jurisdiction in Australia that can achieve that over the medium term and keep the effective reproduction rate of this virus at or below 1, it's the ACT.
So the goal has changed. It's no longer reaching zero. It's as close to zero as possible.
We will do our best to contain this virus. And we have put in place a set of measures that have been effective in avoiding a Sydney-like situation for Canberra, where one case quickly became 10 and 10 would quickly become 100 and 100 would quickly become 1,000. We are not in that situation because of the combination of measures that we have in place. The public health social measures, a good and effective test, trace, isolate and quarantine regime, but it's not perfect, and no system of that kind is perfect, and the higher the caseload, the harder it is to get to people quickly, to test, to isolate and to quarantine them. And then we have nation-leading vaccination rates. And what will bend the curve the most, once we get past the 70% effective vaccination rate, will be quickly, really quickly getting to 80 and then 90, and based on the take-up of vaccination across Canberrans 50 years and older, 95%. To this side of the room.
Yeah, Chief Minister, I just wonder how you make the balance between the damage that the disease is causing and the damage that you are inflicting by putting the ACT through one more month of lockdown, when 51% of this population now is fully vaccinated, over 70% now has one dose of the vaccine. On one side, you're balancing the health risk from a disease. On the other side, you are balancing the damage that's being done to an entire community, the vast majority of whom now are under no threat from this disease. So how do you come to the conclusion that this is the balance to strike? I'll give you just two examples. One, a mother from a child in Malcara, who at the moment can't even walk her child to the local park because that was an exposure site, a child who can't speak, can't see properly, and the only activity he has is to go walking in that park, or the son who can't see his father, who's just gone into retirement care, who his father's dementing very badly because he can't see his family. Now, multiply that across the territory, plus what's happening in businesses. How is this possibly the right balance to strike?
Thank you for the question, Chris. This is one of the most challenging balancing acts that any government anywhere in Australia has to face. But it's not a choice between a good option and a bad option. It's a choice in terms of what's the least worst option available to governments. And all of the circumstances that you outline are very difficult and challenging. But if you want thousands more of those circumstances because there are tens of thousands of people infected with this virus, then the recipe is the alternate pathway. But I do note that not even the New South Wales government is suggesting opening up at a 50% vaccination rate. Not even the Commonwealth government.
You can moderate what you're doing.
And
You can make different
been.
decisions.
We have been moderating. We started at the highest level of public health social measures, and we have been progressively easing with a priority, firstly, on the public health outcomes, secondly, on getting as many people back to work as we can, and then thirdly, focusing on mental health and measures that would support more activity for the community.
Sure.
But this is a tough and challenging period for everyone. But the alternate path is more of the despair and misery that you talk about. There's not a nirvana at the other end here, not at this point in the pandemic and at this point in the vaccination program. So the choices are not great or terrible, and they're the two options we have, and we've chosen a path that protects the health of the community whilst maximising the level of safe economic activity and social activity that we can conduct at this time.
Given the restrictions that most Canberrans have been living under for a month now, why is it that you cannot track down these cases? Is there a particular cohort in this community which is not abiding by the restrictions that you're setting, and why should then the rest of the community that does do that suffer for that behaviour?
There are a variety of reasons. Many people are essential workers who don't know that they are infectious in the community until they develop symptoms, which is often 3 or 4 days after they have been infectious in the community. We have also experienced through our outbreak the virus spreading into many vulnerable communities. This is the same experience that New South Wales and Victoria have had in their outbreaks. It proves once and for all that Canberra is not some elite white-collar public sector city, that it is very diverse and has people from all backgrounds and all socioeconomic status. And so there has been the same sorts of challenges in our jurisdiction in terms of where the virus has spread as has been experienced in Sydney and Melbourne.
Just ask you too about what happened at Lynham High School. You must now have a very good handle on how that was spread and through what age groups. Was it from student to student? Was it from teacher to student or teacher to teacher? And what age groups are we talking about there? And doesn't that then give you a good picture about how you might be able to return to school, given most children will be asymptomatic?
Yeah, so there was student-to-student transmission. Students then infected their parents. The Chief Health Officer can provide some further epidemiological data. We have covered this several times in press conferences that I understand you would not have attended, but that did demonstrate the risk in school settings. It also demonstrated the risk associated with then having 20,000 Canberrans in quarantine, the parents of the kids at Lynham and at Gold Creek, and the impact that that had across service delivery. For example, in our health system, in police and emergency services, and also across the private sector as well. So we are still going to have to operate a test, trace, isolate and quarantine arrangement into the future, and the risk of going too early and without particularly parents being vaccinated, parents of school-age kids being vaccinated, is that you'll have a lot of people in quarantine for a long time, and that will have just as much economic disruption and arguably more social impact, which I acknowledge is a big challenge for all of New South Wales, Victoria and the ACT at the moment. I didn't want to be in this position. We didn't want to be in this situation, and if the virus had been controlled better in New South Wales, we would have been able to continue our more than year-long run of having no COVID in our community. I should invite a question from this side of the room.
Chief Minister, just on schools as well, with Year 12 set to return, that's unlikely to be within the 2 Pfizer doses and then the 2 weeks to make those vaccines effective. Can you clarify why these students will be able to return to school when other student cohorts can't?
Well, they'll obviously have first dose protection, and many would have developed full full vaccine protection by the time we get to the beginning of the school term. There will be COVID-safe arrangements in place. It's a relatively small cohort within our secondary college system, so they are separate from year 7 to 10. They're year 7 to 10 is entirely different schools. And so the Chief Health Officer's advice and the Education Directorate's planning, particularly associated with preparation for their AST tests. So it won't necessarily be a lot of classroom teaching. There'll be a lot of preparation for those tests in that first week of return.
And at this stage, will the vaccine be mandatory or not for teachers and students?
No, there's not a vaccine mandate in the ACT, with the exception of aged care, but there is obviously a very strong community take-up. Mandates are, in the ACT context, largely a solution looking for a problem. We have no issue with vaccine hesitancy in this community. We've got more than 95% take-up of the vaccines across the cohorts that have had access, and forward bookings that indicate that those under 50 are going to take up the vaccine at that sort of level as well. So it's a different community, a very well educated and engaged community who are interested in protecting the health of themselves and each other, which is a wonderful community to live in, I might add.
Chief, you promised Canberrans today you'd provide a roadmap out of the lockdown that we're in. With respect, what we've got today is just a tinkering with a pretty tough lockdown. I spoke to businesses and cafe owners this morning. They were hoping they were going to see some light at the tunnel. What is the changes at 70%, 80% vaccination?
They're outlined in the plan.
Well, what is that for business? What changes at 70%? What changes at 80%? This is just tinkering with a lockdown.
Yes, at 70 and 80%, as the forward plan outlines, a gradual easing of restrictions that would involve things like density limits, things that we experienced last year as we stepped out of our lockdown last year. So people will be familiar with this because we did it last year.
So it's mirroring what happened last time. So at 70% vaccination, it's 1 in 4 square metres for businesses? Those
sorts of measures, depending, of course, as the plan outlines, on the local epidemiology and case numbers. But yes, it will be a progressive step through those sorts of measures. Overall capacity caps, 1 per 4 square metres, things that people are familiar with, a continuation of check-in requirements, those sorts of steps. Then beyond that first measure, you would ease again on the basis of increased caps and 1 per 2 square metres, like we did last year. People are very familiar with a gentle step forward each time as we move out of a lockdown. That's what we did last year.
The difference between this year and last year is last year there wasn't a vaccination coverage at all. Businesses are saying they'd be happy to open with fully vaccinated customers inside, that there wouldn't be a need for those sort of stricter density requirements that were needed last year. There still would be. Yes. So you'd still need that even at 70 and 80% vaccination?
Yes, you would, and that's contained within the national plan if you'd bothered to read it. Phil.
I have a question for Dr Coleman, if I could.
Well, unless I'm taking questions
from
me.
I'll ask you, but okay.
Yes, and then we'll go to Dr Coleman.
If she could elaborate, because it's epidemiological in nature. But if there wouldn't be a parent in the ACT today wouldn't be disappointed about the schools, other than if your kids are in year 11 or 12, there's no vaccine in the world to vaccinate kids from 5 to 12.
Not yet, but there are clinical trials.
Yes, but there won't be this year, right? There won't be this calendar year.
That's correct, yeah.
You're not going to mandate the vaccination of teachers. So how is it fair to those families who have young kids in prep and primary school, basically being told they've lost the whole semester and I suspect won't go back to school, probably for a long time?
Whilst I appreciate you've applied your mind to, yes, you're speculating.
But isn't it owed to those families that you can issue a public health order to mandate the vaccination of aged care workers? Why not teachers, so we can at least get the kids under 12 back to school?
Well, again, that's likely to be a solution looking for a problem, Phil. We don't.
Well, it's a problem now.
We don't. No, we've got a very strong level of vaccination amongst teachers and a priority program. So. Right. I don't believe it's going to be an issue that's going to require a mandate in the ACT.
Could I ask them what's underpinning keeping the primary school kids away from school? Is it because we have to wait till we have to get to 80%?
Well, yeah, so yes, the epidemiological advice from many including Peter Doherty,
Sure.
is you need to vaccinate those around the kids, so the parents in particular. Now, we have a nation-leading vaccination program that is accelerating, and again, you're not a frequent attender of my press conferences.
I watch them every day.
Nor would I expect you to be.
No,
You've got Federal Press Gallery reporting priorities, and that I understand. But we have covered this many times, that what we're going to see in the ACT is that our pace of vaccination is going to accelerate rapidly, partly because some of the supply side constraints associated with the mRNA vaccines finally, this late in the program, being overcome. And we've got, I think, 77% of the population with a first dose now. So we don't have that many more people to get a first dose into. At the moment, the balance of our program is about 60% of the daily vaccinations are first dose. In the coming weeks, that will shift to the bulk of the vaccinations being the second dose. Now, if we're doing 8,000 to 10,000 a day, that means in percentage point terms, we'll be able to go from 70 to 72 to 74 to 76, 78 to 80 in 5 days.
Yes.
And then beyond 80 in another 5 days. So it's going to be really quite rapid at the tail end of the program. Now, implicit in a vaccination coverage of 95% or above is that your teaching population is also going to be vaccinated at 95% or above. And it's pretty clear from the take-up of our priority vaccination opportunities for teachers that they are coming forward to get vaccinated. That, together with vaccinating the parents, allows a return to face-to-face teaching for primary school kids. Another factor is that primary school education is different in that it's generally one teacher with one class or cohort of students, as opposed to high school where there's a mingling across multiple different classes and teachers. So that makes the challenge for primary school easier to manage. In the high school context, we have vaccines for 12 plus, and we're accelerating our vaccination program to vaccinate the high school kids as well.
And I understand that and I appreciate that, but is it really, if we're being honest with people, is it really a case there won't be a return to normality until we get to that sort of late October, mid-November levels you outlined at the start of the press conference? Are we offering people false hope by saying it's just another 4 weeks when we really know it's probably going to be another 4 weeks beyond that? Is that should we start being more honest with people? Well, I'm not accusing you of being dishonest, but more.
I'll presume that you're not accusing me of being dishonest.
Should we start being more forthright with people?
No, look, as we've outlined in the plan and the transition here, we have taken steps to ease our way from the highest level of restrictions, even through this lockdown phase, to where you would be at the point that you would be bordering between high and medium. That's outlined in the Doherty Institute modelling. And then beyond this, we would move through the medium band into the low band and then ultimately to the baseline band, tracking against the national vaccination targets and our own local epidemiology. The timeframes for this can ebb and flow by a week or two, depending on whether there's any more Hail Mary vaccine announcements from the Prime Minister that might bring forward capacity. And I suspect at a national level, at what point in each state or territory you reach the point that all the keen beans, all the people who want to get vaccinated have come forward. Now, the evidence in the ACT is that we're not going to reach that point where we'll get to the vaccine hesitant until we're well above 90%. Now, I don't think that's going to be the case across Australia. I accept that, which is why in our planning, we are adhering to the national plan, which, as I've quoted before, says phases are triggered in a jurisdiction when the average vaccination rates across the nation have reached the threshold and that rate is achieved in a jurisdiction. Now, I think we will cross some of those 70 and 80% thresholds a little ahead of the rest of Australia. But given what I'm seeing in New South Wales and Victoria, I don't think it's going to be that far ahead now.
I just want to ask you about Canberra's public health workers who've been doing an amazing job since the start of the pandemic. Even when the ACT was COVID-free and national numbers were low, those working at Canberra hospitals, for example, were subject and are subject to much stricter screening processes than the rest to go to work than the rest of the community. So they were unable to go to work if they'd been to LGAs where there'd been a case in the previous month. Moving forward, and as we hit these vaccination targets, will these health workers continue to have to adhere to these much more strict screening measures, perhaps not seeing their friends and families interstate for even longer than they've already had to endure as restrictions start to ease for the rest of the ACT community?
Well, they are very high-risk settings, and there will be presumably a lot more COVID in our health system in terms of people needing care and support as we transition out of lockdown. Doesn't matter, which vaccination threshold you pick. All of the Doherty Institute models show that there will be an increase in cases, an increase in hospitalisation, and an increase in patients needing intensive care. Really, the extent of that will be determined by the level of vaccination, and given a choice, acknowledging the points you have raised in relation to the requirements on healthcare workers, I don't think the general community would forgive a government that allowed a significantly increased risk within a hospital setting. But we will obviously examine the situation in terms of COVID in local government areas and all of our public health directions as the nation steps forward through the different vaccination phases. But I'm not making an announcement on ACT government policy right now.
Sure, but is there any sort of planning sort of going ahead policy-wise? Because,
yes, of
these
course.
workers have been shouldering an enormous burden and, even at the beginning of the year when people were travelling freely, they were going to New South Wales, these workers couldn't. So, what kind of promise can you give them? Will they be able to see their families at Christmas?
I'm not giving promises about that today from this podium. The commitment that I will give is that we are looking at that workforce planning and management. We will be recruiting more staff. We will allow people, obviously, to get the rest and recuperation and all of the basic human needs that those people who have done an incredible job for our community for 18 months of this pandemic, and who we will be relying on over the next 12 to 18 months as well. So we are aware of the issue, but today's not the day to be making policy decisions on the run from this podium. But I am aware of the issue. We are working on it.
And you anticipate that ACT residents will be able to travel interstate by Christmas time?
Based, of course, on the decisions of the other jurisdictions. I don't control the borders of Western Australia, Tasmania, South Australia, Northern Territory, etc. But we would hope so.
Chief Minister, do you accept that the economic impacts of this lockdown and its extension will be long-lasting? What's your message to those businesses that even with the financial supports likely won't recover?
Look, this is a challenge that every city, every jurisdiction, every country in the world is currently experiencing. Comparatively, the ACT has done very well over the last 18 months. And we will continue to do what we can within the confines of pandemic management to support businesses through to the other side of this. What I am confident about, based on last year's experience, and based on what I anticipate to be very high levels of pent-up demand amongst consumers for a range of experiences and desire to spend heading up to Christmas, will be a very big second half of the fiscal year in this community. And the evidence of what economists would call a V-shaped recovery was there last year, and there's no reason to think it won't be there again this year.
How many businesses have been paid out in the business support grants, and what is the total dollar value of those payments?
As of yesterday, the total amount paid out was 17.26 million, and the number of businesses is over 1,000, and I'll get that. I will get that exact number to you. It's about 1,100.
And you said last week that 1/3 of businesses were in making applications with incorrect information or incomplete. Is that still proving to be a problem, given 5,000 businesses have expressed interest in this and only 1,000 people have been paid out?
So there's obviously been a re-engagement with those businesses to seek the further information that's generally been supplied, and has allowed the team of more than 100 assessors to quickly move through and process and approve and make those payments.
Chief Minister, when is it likely childcare centres will be able to open up and cater to more families? We've got a lot of parents who are juggling work with home learning at the moment or looking after smaller children.
Well, in the lockdown stay-at-home arrangements, they're available for essential workers at this time. So there's a review point in 2 weeks, but I think it would be likely that whilst we remain in lockdown, that they will be there for essential workers for the next 4 weeks.
And it was asked before, you said you don't control the other states' borders, but do you think Canberrans are being unfairly locked out of other states at this point?
No, if I was the Premier of Western Australia, Premier of South Australia, the Premier of Tasmania, the Premier of Queensland or the Northern Territory Chief Minister, and enjoying life COVID-free, and with vaccination rates as they are in those jurisdictions, I would be endeavouring to keep COVID out for as long as possible, recognising that there will be a point when each of those governments will need to make a decision. But in the meantime, they should be furiously vaccinating their community in advance of the inevitable national opening up. But I suspect that that's going to differ depending on whether COVID creeps into some of those jurisdictions before the nation crosses the 70% and 80% thresholds. I mean, we are all in this situation because of a failure in New South Wales. We all know that. That failure has spread into Victoria and the ACT. I hope for the sake of those other communities that they are able to keep COVID out for as long as possible. But we all need to acknowledge ultimately that the desirable outcome is that there aren't internal state borders in Australia. I hope that happens by Christmas. It may not, but I hope it does.
Chief, given the difficulty in forecasting COVID, how confident are you that the roadmap to the easing of restrictions is how it's going to go? I mean, this was supposed to be a short, sharp 7-day lockdown.
Well, look, COVID is unpredictable, and you have to respond to the circumstances that are in front of you. We've outlined our guiding principles, that we will focus on public health, that we will do what we can to get more people back to work, and we will focus on measures to support the mental health and well-being of our community. They are the clear overarching principles that guide our decision-making. We then look at our role and responsibility within the national plan, the often misquoted and misrepresented national plan that we signed up to on the basis of what it actually says, not what some media outlets and some federal politicians say it says. And from this podium on at least 20 occasions, I have had to correct misinterpretation of the national plan by certain media outlets. Now, they're pushing their agenda and their wheelbarrow, and that is what it is. That's the Australian media. But it doesn't mean that you can't push back against it with facts. Now, none of the states and territories signed up to the national plan without reading it and without being focused on the detail of it, including, and this will be the subject of further discussion at the National Cabinet on Friday and presumably beyond, that there were some elements of the one page that would require further detail and deliberation. Some of them, clearly in brackets, were to be determined, and the headings on each of the sections talked about things that may occur. So we're about to have that next round of detail. I know the nation wants to know that and what it means and what it will mean in each jurisdiction. But it is important that if we've signed up to a national plan, that we actually adhere to it. And the national plan has some important protections. You could argue at both ends of the spectrum against rogue jurisdictions doing crazy things ahead of the rest of the nation, but also ensuring that there wouldn't be recalcitrant jurisdictions who did things so slowly as to stop the nation advancing. It's a good plan to that extent that it achieves both of those things. Anything else on this side? Back to you, Chris.
Chief Minister, and can I first note, of course, I've known you for a long time and don't assume that you do anything in bad will, and these must be difficult decisions, but of course they're time for difficult questions as well. In the national plan that you've signed up to, it hasn't indeed been open to interpretation by premiers, as we have seen, and they are making different rules as they go along. You have control over this jurisdiction, and as you've noted, it's one where they're more likely to take up vaccination than anywhere else. You are more spread out than most jurisdictions. You have a lesser risk profile than a lot of other jurisdictions. So the only question, I think, is in the balance that you are striking between the risk from the disease and the risk that is attendant with the decisions that you are making to the community. Is there anyone around your table who is saying that now the risk balance is on the wrong side?
No, we have a very good and engaged cabinet. So it's the entire cabinet, all 9 of us, together with representation from the health perspective through the Chief Health Officer, business representation through our Economic Development Directorate, Treasury. I don't have a small subset of cabinet engaged in this. I'm not locking people out of input and decision making. Now, I only have experience operating within the ACT government, but those who have worked in other governments larger than the ACT generally observe that our processes and the fact that the government is of this size and has the range of responsibilities that it does offers often best practice in public administration. And given that Canberra is the home of public administration in this nation, and we have many people who have experience both at Commonwealth and at state level who have or are now working within the ACT government, now I'm very confident in the diversity of views represented, the contribution of all of my cabinet members, and the Directors General of the different areas of ACT government, and outstanding public health advice offered by a fantastic Chief Health Officer and her team, who I have immense confidence in. And I think the ACT response has been very good. We've made mistakes along the way. Every government will, but we've tried very hard not to repeat mistakes. Unfortunately, that is not the case in every level of government across Australia at the moment.
Just 2 things, given that the national plan is open
They're
to
used
interpretation.
to ceding, and I should say, Chris, we have known each other for a long time, and I don't take any of your questioning personally.
I know.
If you had a thin skin at this podium, you'd be in a lot of trouble. And please, your next question, and then to Phil.
Sure, and as I say, no one underestimates how difficult this must be for you. So that goes without saying. Just a couple of quick things. Obviously, New South Wales will have its own interpretation of the national plan. Will you move at a different pace to New South Wales? Obviously, that is the one border that matters to us.
Well, we've indicated that decisions that New South Wales take are a factor in our decision making. Our own local circumstances, our own local epidemiology, our own local economic conditions are the principal factors that drive our decision making. But of course, we need to look at what New South Wales are doing. Now, in that context, I have drawn a distinction between their policy approach for the Greater Sydney area and then regional New South Wales, which has differed, and I've acknowledged that on many occasions. So perhaps initially the most pertinent thing is what's happening in the Canberra region. They had an experiment with easing the lockdown in Yass, and 2 days later they had to put it back in place. So that's an example of, I guess, yo-yoing in and out of restrictions that probably hasn't worked so well. So that's a factor. New South Wales approach more broadly, well, there is the inbuilt protection within the national plan about the 2 turnkey. I remember the Prime Minister at a late night, late winter press conference, on the porch of the Lodge, talking about the 2 turnkeys here, the nation and the jurisdiction. That was principally put in place for 2 reasons. One, to protect against New South Wales doing something crazy too soon, and also to protect against other jurisdictions taking too long and holding the rest of the nation back. Now, the reason I made the observation in my opening remarks that the national position is going to be driven largely by what happens in New South Wales and Victoria, just the sheer weight of numbers determines that. So that means that there will be quite a likely alignment within several weeks of each other potentially of what does happen in New South Wales and Victoria and the ACT.
This is actually on the public administration level, which you pointed to. The territory was set up to house the federal government. The Prime Minister is off to the United States shortly. Obviously, he will have to quarantine on return. He can do that in the Lodge.
He can. He's done it many times.
Those who are accompanying him can't, and this meeting in particular, where there'll be the first meeting of the Quad leaders, is an extremely important one. If you were coming from interstate, from Sydney, where there's a bit of COVID at the moment too, you could quarantine at home. If you're a diplomat, you could quarantine inside your residence. Can the journalists who attend with the Prime Minister quarantine at home on return? And why would they be any less safe than someone?
You are inviting me to comment on the trustworthiness.
We know your views on the media. Just
the Federal Press Gallery. Oh dear, this is space that do I dare to tread into. Look, we have had in place a range of quarantine arrangements that have obviously differed depending on the risk profile of individuals, where they've travelled to, what the COVID profile is. We are an eager observer of the South Australian home quarantine trial. We like what we're seeing there. And so there is potential that something like that could be put in place. When's his trip again?
He's actually going to be in Washington next Friday.
Next Friday. So Friday. How long for?
4 days, Phil.
He's away all this week.
Yeah. All right. So you'd be. So we're talking several weeks away.
1 week.
All right. Let me take that one on notice, and we'll provide. I mean, I'm sure there's an audience of about 10 who are very keen for the answer.
Chief Minister, give me your power.
The other 100,000 people watching, probably not.
Can I ask on behalf of those other 100 or
yes,
so thousand
please,
watching?
Phil. Yep.
And just by the amount of text messages I've had, there's a fair bit of disappointment out there at the sort of, I guess, people are expecting a little more in terms of opening up, and they've got today. You've given your reasons. Can I ask how wide did yourself, Dr. Coleman, others who make these decisions actually consult with stakeholders? Do you go to business and say, what can you do to operate in a safe manner? Did you go to golf clubs, tennis clubs, etc., and say, because I know they say you can play social sport but not competition sport. As a golfer, I don't understand the difference in terms of safety protocols. For example, we played competition golf last year, and the clubhouses were shut, and you couldn't touch the flags and those sorts of things. So did you go to I'm speaking, but I'm saying, did you consult business? Yeah. Did you ask business to come to you and say, tell us what you can do to operate in a COVID safe manner, or how much in the loop are the businesses of the ACT? Yeah.
Every day, every weekday, I think it's either at 12 or 12:30, there is a ACT government business hookup with all of the peak industry associations every single day. I have received both written and verbal input formally from organisations as diverse as the Master Builders Association, the Housing Institute of Australia, the Canberra Business Chamber. I've had the national level bodies in Innes, Willix, etc., all writing, providing either national or local level perspective, often down to the minutiae or sort of the broader picture of what the pathway is forward. So in a jurisdiction of our size, we know them all, we see them all every day, and I don't think there would be a jurisdiction in Australia that would have a closer level of engagement with all of those industry peak bodies. Now, it just so happened that 3 days before the first case and having to go into lockdown, I gave a major address to about 300 members of the Canberra Business Chamber outlining what would happen if and what our approach would be. So we've been engaged from the start. This is the second sort of experience of coming out of lockdown that we've had in this city, and engaging with each of those industry stakeholders. I forgot to mention the AHA. They are another that we engage with on a daily basis.
So their views have been taken
Oh,
into
yes,
account.
yeah, absolutely, yes. And in fact, their views have enabled various specific smaller tweaks and some of the larger ones associated, for example, with the small business extension in terms of the number of workers who can be on site, undertaking the click and collect and online ordering and delivery arrangements that affect thousands of businesses. And one of the implications of today's decision is that thousands more can return to work. 20,000 construction workers are now back at work. We had about 50,000 people who were effectively furloughed. We've got more than half of them back now over the last month. Anything else for me? I feel like I've been here a very long time.
If the Chief Health Officer
Certainly.
is available,
Okay.
I understand
Yes?
she needs to go.
Indeed. Thank you.
Thank you. So 8 separate incursions of the virus have come from New South Wales, and you said 2 of those came from the past 24 hours. Can you just provide a little bit of insight onto those 2 incursions? Are those people that have been in quarantine, or have this spread in the community?
So interestingly, 6 of the incursions have come from New South Wales, but 2 have come from Victoria. One of those from Victorian is definitely someone who has received an exemption and therefore, as part of their testing on day 1 of quarantine, has identified COVID. So a great example of how that system is working to limit spread here. The second example, it's too early to be able to give you much more information on the circumstances of that. We're still investigating.
And you said, so there was 3 clusters. So there was 3 clusters that came from 3 incursions. Mm-hmm. So were 2 of the other ones, and we obviously know the initial first cluster, were those from people who were perhaps not in quarantine doing the wrong thing that way?
Oh, look, I don't have that information to date at the moment, but just to say that I think approximately 90 to 95% of our cases are associated with our first cluster incursion. I think the point of talking to the additional incursions that we've seen where it's seen ongoing transmission, that at this point with our vaccination coverage not at a high enough level, if we don't have some level of public health social measures like we have now, if those are undetected, we won't be able to stop that spread from happening. So I guess the point is with ongoing opportunity, whether it is managed incursion or an unmanaged incursion, the risk very much continues to be there.
Doctor, with 1,000 self-identified close contacts, what does that do for your modelling for case numbers in the coming days and weeks? Are we going to likely see them increase, given what we know about how the virus affects household contacts?
Yeah. Look, the modelling for a small jurisdiction or the projections on what we can anticipate is really challenging because what looks like large numbers are actually just small variations. What I think and what I think the numbers is showing us might happen, we have a small chance that the trend could increase a little bit, but keeping the restrictions in place that we have at the moment, we do not anticipate that rising far at all to be problematic. And then over the next 2 to 4 weeks, we are going to see that start to decline. Hopefully. There is a chance that those numbers will remain steady, and this is one of those problems that we have with Delta. It is really, really transmissible, and we are still really trying to work out what is the level of community restrictions that we need to offset the vaccination coverage to limit that spread to keep it under control.
So what has been your advice to government then? Is 0 an attainable target?
I think, as the Chief had said, we'd all like zero, but I think increasingly with the examples in New South Wales and Victoria, that aiming for zero who are infectious in community is a really good first start. But I would provide caution that this may be the start of what we may be working towards, that we will be seeing a steady level of cases continuing to move forward, and that is what the national plan is looking at. How do we keep those public health social measures aligned with our vaccination coverage to maintain that we don't get an escalation of cases that actually causes us too much of a stress on our health system as well as our community? So my hope is still that we can have zero infectious in the community over the next couple of weeks, but we do start to need to consider that this is what we're moving towards as part of the national plan.
Hi, Dr. Coleman. Okay. Forgive me if you've been asked this before, but given just what you said, about the prospect of zero COVID and so forth, what other states have modelled their capacity of their health system, as we do open up in terms of ICU beds and stuff. What is Canberra's sort of, taking into account the Garran Surge Centre, what is Canberra's capacity in terms of, cases in hospital, ICU, so forth?
Yeah, so I'm not able to talk to specific numbers, and it might be something that the Health Minister is able to talk around a little bit too. But absolutely, the impact or the capacity of both the hospital system, but also our primary care system. So we need to actually look, and we have been looking very closely about how does our whole health system as a whole adapt to move towards having COVID in the community as a norm moving forward. We also have that additional factor of being in the middle of southern New South Wales. So we're working very closely with our southern New South Wales neighbours about what are the implications for cross-border care as well. So we are confident with the case numbers at the moment that the system is very well able to support that. And what we need to do is continue to work on how we actually work on our system moving forward to allow us to continue to do that comfortably.
I have a question as well. Just on outdoor gatherings, you saw at the weekend lots of people making the most of the weather with these 5 people non-recreational activities, picnics, for example. Would you be comfortable at some point of the vaccination to allow business to that sort of model, but outdoor dining? Is it possible that we could move to that model to allow business to kind of get back on their feet?
Yeah, look, it's a really, really good question. And when we think about what poses the greatest public health risk versus what are the lower public health risks, and us trying to prioritise opening of the lower risk options first to balance off that mental health and wellbeing aspects, which I'm hearing is really causing a lot of concern in community. You are right, outdoor areas are much lower risk. And I think if you remember last year, we did look at outdoor dining opening first prior to indoor dining, as also having lower density restrictions on outdoor as opposed to indoor. So we're actually, all of those options are being worked through over the next 2 weeks. My colleagues in other jurisdictions, we are working really hard to try and understand what those public health social measures look like together as a good fit to counterbalance the spread, so that when we come to you with a plan about it's really evidence-based and we've really thought it through and have the best chance of it working. Is
that plan, do you think, at the 2-week checkpoint, or is it more likely to be at the end of the 4-week lockdown? You can obviously understand people and businesses are trying to plan. Absolutely. And they thought today was the day, and they've kind of found out that there's nothing for them.
I can absolutely hear that frustration, and I have it myself. We are going as fast as we can in reviewing the ever-changing evidence base. And I understand that National Cabinet will this week as well as next week, if it's on, consider these as well, and we are going as fast as I can. We will bring it to you as soon as we possibly can, but we don't want to raise false hope and we don't want to give false ideas to people. My experience is that I don't want people to be working towards something that we aren't very sure about at this point in time. But over the next 2 weeks, we will certainly be having that conversation.
Just a separate question about your health advice on the border. Given New South Wales has changed some of the regional areas that are in lockdown, take Yass out of the equation, would you consider opening up to those areas back to a targeted hotspot model for New South Wales, or is the whole border still closed for a long time going forward?
So at this point in time, the whole border is going to continue to be managed as we have been managing it. Part of that is because we are focusing very much on managing and getting our own case count down here in the ACT as our primary focus, and we really want to minimise the risk of further incursions coming in. I think that we will eventually move to a more refined model, similar to what we've done before, as we progress through those pathways, those phases of the national plan, ultimately leading to having open borders, and hopefully I can go home for Christmas to Perth as well, which is what I'm hoping for, but we'll see.
Okay, thanks everyone.
Thank you.